And then next is managing challenges. Managing challenges can be huge for everybody. If you're suffering from depression, they can be even more huge. So this is to provide an exercise for you to help your client. So as you're getting to know your client, they're probably going to be sharing challenges. Maybe it dates back to getting to know you and what are the obstacles that you might face in getting to your appointments or filling your medications. You can really be a guide to your client and to help them not only just manage that one challenge, but actually change the way they manage challenges in the future. Sometimes a challenge can be so overwhelming, you could just sort of circulate and agitate and not really get anywhere, but become purely exhausted just thinking about it. So this is an opportunity for you to sit down and say, okay, let's try and figure this out. Let's do this exercise and pick a challenge. What is a challenge that you're having right now? And maybe it's transportation. Okay, so it's getting or coverage for your children to go to your support group. Let's take that for an example. My challenge is that I don't have coverage. I don't have childcare. My goal is I want to go to this support group once a week. Okay, what are the options? And so get them to write that down. My challenge is I need someone to take care of my kids. I need childcare. My goal is I want to attend my support group once a week. Okay, let's talk about the options. What are they? What are your choices? And go through, there's a spot for 3 choices, but of course there could be more if there are more. Okay, so let's see, what are the possibilities? You get a babysitter? Okay, that's a possibility. And here the sky's the limit. There's no discerning what's a good idea or what's a bad idea. You could just exhaust this list. Okay, get a babysitter. Okay, have my mother-in-law watch the kids. Have my girlfriend next door watch the kids. Have my ex-husband watch the kids. Whatever, the list could just go on, right? Okay, so then you take one at a time. Hire a babysitter. What makes that a good choice? Well, it would be dependable. Would be any cancellations. You know, list all the good things about that. What makes this not a good choice? Well, it's expensive. Okay, I don't know anybody. Whatever. Think of all the reasons why that's not a good option. Okay, what's the second one? Have my mother-in-law watch the children. What makes that a good choice? Well, she's very reliable. Okay, that's very good. What else? The kids like her. Okay, that's good. Why is this not a good choice? Well, I don't like her. Okay, well, let's write that down. What are all the other choices? The reasons this is not a good option? And again, you don't let them just be creative and think of all of them because they don't have to make a decision yet. Okay, what's the third one? What was the third one? Get the neighbor. Okay, the neighbor is convenient. She's right next door. Kids like her. What makes it not a good option? She's not so reliable. Sometimes she comes home late from work, and so I couldn't depend on it. So what you're doing is you're sort of getting her to step back and go, okay, I can see the picture more clearly now. And looking at all these options and the pros and the cons of each option, I can make a decision that I can live with because I've gone through a process. And I'm going to decide to go with my mother-in-law. Even though, you know, she's going to like this, she's the best choice. You know, I can afford it. She's reliable. The kids like her. So if she's going to bug me, I have to just know that my goal is more important than what makes it not a good option for me personally. And so when she starts to, you know, press my buttons, I'm going to remember my goal. And I'm going to go, it's so important for me to go to my support group every Monday that I'm willing to pay the price for that choice. And that will make it easier for me when she presses my buttons. So it's a simple example, but it's the pathway for helping somebody learn how to manage challenges in a way that they can live with it. And there's probably no option that is super perfect, but at least it's an option that they'll be able to live with easier. So if you can sit down with somebody and actually do that exercise with something that's maybe simple and easy, and then each time work on a bigger or more complicated problem, it's a stepping stone. And then lastly on this page is making pleasurable activities part of my daily life. It's the same map. It's just something positive. And in the beginning, we asked them, what do you like to do for fun? And maybe they couldn't think of anything. But now we've gotten to know them. And we've heard some stories, and we've laughed a little bit, and we know that they like, music or whatever. And so we can present it in such a way that we can help them to figure out a way to do something pleasurable, because sometimes they'll say, oh yeah, I like that, but. Well, let's deal with the buts. Let's figure out, what is your goal? What do you want to do? Do you want to get involved in, I don't know, photography or whatever, something that you used to do? And so your goal is to take a roll of film and shoot it or something. Okay, what are your options? And maybe finances are an issue, so we know we're going to have to deal with that. So we're going to explore some possible options. Now that's a kind of a complicated one, but we might have to start out with something like socializing. I would like to just socialize with somebody once a week or something, but I can't even think of anybody that I'd want to hang around with. Just the thought of being in a conversation just frightens me. Okay, so let's start really super small and think of what your goal is. If it's to do something social, maybe you're not going to do it right off the bat, but maybe there are some options that will build towards that. Maybe we can think of some other things to do during this week that are safer. Maybe it's, go and sit at the Starbucks for 15 minutes, and have a cup of coffee and read the newspaper. And maybe, you'll strike up a conversation or something, but it's a building block. It's free. And you go through the same things. What's the list? What are the possibilities in your neighborhood? What makes it a good choice? What makes it a bad choice? And then make a decision and try it. And then maybe you'll revise this and you'll do something different next week or next month. But it's a map for them to start to figure out ways to get what they want and to deal with problems. So I hope that helps you, help your clients manage their wellness. So we're helping our patients with their treatment options, and we're also involving them in a wellness plan. This is a positive anchor. It's a rope for them to grab, and hopefully it'll help them. All right, I believe that wraps up webinar number 3. I'd like to thank you for joining us for webinar 3, and I'll see you next week.